Music on cognitive function in older adults with type 2 diabetes. Mental and cognitive deterioration is widespread in older adults with type 2 diabetes. The use of music has appeared to improve cognitive health. Rewards from music have been shown to improve mental and cognitive function. Even though it is not specifically mentioned, singing, listening and playing instrument all contribute to better mental health and cognitive function. This study or research listed in the description investigated which factors of musical reward impact cognitive function in older adults with type 2 diabetes. Secondary data analysis was conducted with 185 older adults with type 2 diabetes and subjective cognitive decline. Among the musical reward factors, mood regulation significantly influenced subjective cognitive function. The findings suggest that music interventions for older adults with type 2 diabetes may need to focus on managing their psychological states for the intervention to have beneficial effects on cognitive function. Future rigorous studies with larger sample sizes should be done to obtain robust evidence for optimal music interventions for older adults with type 2 diabetes. Diabetes is leading to elevated blood glucose. This causes inflammation and raises the risk of damaging blood vessels in the brain. This in turn increases the risk of cognitive decline. Recent research demonstrated that mental weakening was present in 63.8% of older adults with diabetes, as compared to only 10.8% of older adults without diabetes. Changes in brain structure and brain activation patterns are found in obesity and insulin resistance. That is even before the development of type 2 diabetes. Type 2 diabetes indicates that many who develop that may already have alterations in cognitive function. Even though the criteria for a dementia or mild cognitive impairment diagnosis are not met, they already have cognitive issues. People with type 2 diabetes can have thinking problems even if they can still do daily tasks. This is different from dementia, or they do not reach a level to be classified as dementia. It makes everyday activities hard for diabetes sufferers. Thinking problems can make it harder for people with diabetes to manage their disease. They might forget to take medication or check their blood sugar. Thinking problems can also turn into dementia later. Every year, almost 20% of people with thinking problems develop dementia. We need to help older adults with diabetes to keep their minds healthy to avoid these problems. Music might be a good way to do this. Studies show that listening to music can improve memory and thinking in people with brain problems. Music works because it makes our brains feel good, and that helps us learn and remember things better. We need more research to understand exactly how music helps, but it looks like it could be a helpful tool for people with diabetes. While we are in the middle of the video, do not forget to hit the like button. See the description and comments for references. We would appreciate your comments. People experience musical rewards through various musical activities such as listening to music, dancing, or sharing musical tastes with others. Musical reward is complex and multifactorial and depends on personal experiences. As a result, there is substantial individual variability and sensitivity to musical pleasure. The individual differences in music reward experiences can be classified into 5 factors: music seeking, emotional evocation, mood regulation, sensory motor, and social reward. Music seeking is how an individual seeks information related to music or pursues musical activities. Emotional evocation is the emotional impact of music. Mood regulation refers to how music modulates and releases emotions. Sensory motor refers to body movements induced by music. The movements are not limited to dancing but also include simple movements like tapping or humming. Social reward is related to the pleasure of sharing music-related activities such as concerts and musical preferences with others. The variability in these factors is associated with brain structure and connectivity, which can further influence cognitive function. Several studies have demonstrated that people with higher musical rewards achieved better memory performance. Despite the benefits of musical reward on cognitive function, little research has been done on older adults with type 2 diabetes in relation to musical reward. Investigations on how each factor like music seeking or mood regulation of musical reward impacts cognitive function in older adults with type 2 diabetes can provide insights into effective music intervention strategies for diabetes-related cognitive impairment. To our knowledge, no studies have focused on each factor of musical reward in this population. Therefore, this study aimed to answer the following research question: what are the relationships between the factors of musical reward and cognitive function, especially in older adults with type 2 diabetes? We hypothesized that specific factors of musical reward would be positively associated with cognitive function. Music and musical reward factors could be a potential target within future interventions to improve cognitive function. Of the 204 participants in the data set, 17 were excluded due to missing demographic information. Also, participants who did not engage in any musical activities were excluded. Among the 185 participants, 73.0% were female, and 26.5% were male. Most of the participants were non-Hispanic white followed by Black or African American. The average age of participants was around 60. This research found that the musical reward factor of mood regulation had a significant positive association with subjective cognitive function. However, none of the musical reward factors were associated with objective cognitive function. This study's findings highlight the potential importance of music in regulating mood. The present study showed that mood regulation was the only significant factor influencing subjective cognitive function among the 5 musical reward factors. This association. The present research examined the impact of each musical reward factor on cognitive function in older adults with type 2 diabetes. We found that the reward of mood regulation significantly influenced subjective cognitive function. This finding may provide insights to everybody to incorporate music into their daily life to keep their mental state healthy as a low-cost medicine. However, limitations should be acknowledged, and the findings should be interpreted with caution. Do not forget to click the like button. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video.